Good morning, everyone. Welcome to our channel. Here at Cwuick, we want to help you manage your health. Whether you're a patient or a caregiver, we understand how overwhelming it can be a part of a medical system and have to deal with so much medical information. So today we're going to start off with going over how to create your own medical history overview document, just to keep you organized and up to date with everything that's going on with you. Now, before we got started, I just did want to add a disclaimer that anything in this video is purely for medical education purposes. It is not medical advice. So let's get right into it. The first section that we want to include on our medical history overview document is medical conditions. So we want to make sure that we list all of our medical conditions because it will help your healthcare team with determining the appropriate health screening that you require, any complication prevention strategies, and even with determining what medication options are safe and appropriate for you. So, for example, if someone had diabetes, they would need to get more frequent eye exams to check the back of their eyes to make sure there isn't any damage there. If someone had a very severe heart condition, their dentist may give them antibiotics before dental procedures to prevent heart infections from bacteria in their mouth. And when it comes to medication options, one example I can give is if someone has Parkinson's disease, they actually can't take every anti-nausea medication that's available. Some of them can actually make Parkinson's disease worse. So those are just some of the reasons why it's really important that you keep your medical conditions accurate, easily accessible, so your healthcare team can make the best decisions for you based on whatever you're going through at that time. Next on our list, I'm going to add surgical history. So any surgeries that you've had in the past, any procedures that you've had in the past, I would record those as well. And for both of these sections, what I would do is I would record what medical condition I have or surgery I've had. And I would also include the date if you remember it. So why is it important when it comes to surgeries? In certain cases, surgeries can also help determine future treatment decisions. So for example, if for some reason someone had to have their spleen removed, they're now at increased risk of infections because your spleen plays an important role in your immune system. And for that reason, your doctors may prescribe you antibiotics to take in the event of a fever, or in certain countries, some people take antibiotics to prevent infections. The plan itself will differ depending on your specific conditions and your history, but it's important that you have record of all of these things so your healthcare team can make the best decisions for you. So that's section number 2. The next section is family history. So whether it's a first degree relative, second degree relative, I would write down if they have specific health conditions and what it was and how they're related to you. The reason for this, similar to the others, is if you have a genetic risk of certain conditions, you may require extra screening compared to the general population to help catch it early in case you are at higher risk, and or think of ways to prevent those sorts of things from happening to you in the first place. Next on my list, I've got allergies. So I'm also going to add intolerances on here as well. And there's a slight difference between the two that I'll try to explain. When it comes to allergies, I want you to write down what you're allergic to, what your reaction is, and how it was treated. And all three of those questions are really important because if there is a certain medical situation where your healthcare team needs to choose between different medications and you supposedly are allergic to one, it's important that we know if that reaction is severe or mild. If it's something mild, then your healthcare team may decide to use it on a short-term basis if you're in, let's say, a life-threatening situation and for some reason that's best medication for you to help you. When it comes to mild reactions, think of those as side effects from medications. Those are intolerances. So if you got very drowsy from a medication, if you got dizzy from a medication, if you got sleepy from a medication, that's not necessarily an allergy. It could just be a mild intolerance, or you may just be more sensitive to it and you may experience side effects more so compared to other people. When it comes to a true allergy, if you've had a rash, if your throat got swollen up, if you had difficulty breathing, those are more severe reactions. And in that case, we may not take the risk of using whatever medication you had that type of a reaction to. The main point here is make sure that you include the reaction and how you were treated. If you did require any treatment for any allergies or any reactions that you've had in the past, you don't have to worry about classifying your reactions into allergies or intolerances. Your healthcare team can take care of that. Next on the list, I'm going to add social history. So you can think of this as your lifestyle factors that can impact your health. So some common questions that you may get from your healthcare team is your smoking status. So are you a smoker? Have you ever smoked in the past? Have you never smoked in your entire life? And this can be relevant depending on the different health conditions you have and how we can help you manage them better. Another common one would be alcohol use. If you do drink, how often do you drink? That's worth recording. Some of these things can also impact medications, so that's why it's worth recording these data points. Now, other than smoking and alcohol, the other things you can write down include diet, physical activity, stress, sleep. All of these different things can impact your health, and you can choose what you feel is most relevant based on your history and what you're going through at the moment. But it's worthwhile including, especially if any of these specific data points are applicable to you. Now I'm just going to get rid of this to make this nice and simple. Next on our list, we are going to have medications. Now, if after going through this list, you feel like it's too overwhelming, there's too much to track, if you were only going to pick one section, I would pick the medication section. And I'm biased because I'm a pharmacist, but I'll explain why. When you look at all of these other sections, generally the information there doesn't change that much. So if you had a medical condition, unless you reverse it somehow, you're probably going to have that for life. If you had a surgery back in 2010, that data point isn't going to change. However, when it comes to medications, medications are very dynamic. So whether you're going to your family doctor's office or you're going to a specialist's office or you're getting discharged from the hospital, everyone may have their hand in the pot and everyone may be making adjustments. And if you are getting adjustments made by different members of your healthcare team and they don't necessarily have access to one list, they may be making decisions based off of inaccurate information, and that can be dangerous. So we want to make sure that we're documenting all of our prescription medications, anything that we're using over the counter, whether that's natural supplements or vitamins and minerals, everything counts. And it's even worth including a list of medications that you've quote unquote failed in the past. So if you have a very complicated history and doctors have been trying to figure out something that works best for you and you have a laundry list of medications that haven't worked, it's worth writing those down and the reason why it didn't work, or maybe it just didn't do anything in the first place. Because having that information in one place, with it being clear and concise, it can help expedite the process of trying to find something that works best for you. Now, while we go through the medication section, I do want to go through an example because it's often very easy to accidentally miss important information that's required to make sure that your medication list is accurate. So I'm going to write these down. The first thing that we need when we're writing our medications down is the medication name. So I need to know what you're taking. What's the name of it? After that, I need to know the strength of the medication or the concentration. So these are just different words explaining how much is in a pill. So how many milligrams are in a pill, or how many milligrams are in a certain amount of milliliters if you're taking a liquid or if you're getting an injection. We need to know that information. After that, we need to know the dose. So if you're taking a pill, how many pills are you taking? If you're taking a liquid, how many milliliters are you taking? That's the kind of information we're looking for. After that, we want to include the route of administration. This is just a fancy way of asking you how you take the medication. So if it's a pill, you take it by mouth. If it's something like an injection, you're getting an injection. If you're taking something that's under the tongue, you should write down that you take it under the tongue. There are different ways that you can take medications, and sometimes it can affect how they work. So it's important that we get that right. Now, after that, we need to include the frequency. So how often do you take that medication? And last but not least, depending on the medication that we're talking about, it may also be relevant to include a due date. Let's try to go through an example to make this a little more clear. So I'm going to pick one medication, metformin. So metformin is a very common medication used for diabetes. And right now I've written metformin, so I've got the medication name down. After that, now I need to think about the strength. So how many milligrams are in one pill of metformin? I'm going to write 500 down. So I've got the name, I've got the strength. Now I need to think about the dose. So how many pills do I take? I'm going to say I take one tablet. So we've got that. Route of an administration, how do I take it? I take one tablet by mouth. In terms of the frequency, I'm going to say I take it daily because I take it once a day. And in terms of the due date, it's not really relevant in this case. So you've got metformin, the medication name, 500 milligrams is the strength, one tablet is your dose, by mouth is the route of administration, it's how you take it, and daily is the frequency. Now, when it comes to an example for a due date, I'll think about osteoporosis medications. So if you've ever heard of Prolia or Jubbonti, it's a medication to help keep your bones strong for people who have osteoporosis. And it's typically given every 6 months. If you have a medication that's given infrequently, it's worth writing down when you last had your dose and when it's next due, because we want to make sure that you're keeping track of that information to make sure you don't miss the dose, and then you're no longer gaining the benefits from that medication. So in the case of Prolia or Jubbonti, if you missed a dose, you're at increased risk of getting a fracture, and we don't want that. So that's one case where it would be relevant to include a due date. So that's medications in a nutshell. We went over how to include all of the relevant information. We mentioned that it's also worth adding a section of failed medications, if you remember, just because sometimes over time you tend to forget what you've tried before, and especially if you've been to multiple different specialists trying to figure something out, it can get really frustrating having to repeat yourself. So if you have one reference to go through that's easily accessible, it can make your life a little bit easier. And one last thing that I'd want to add about the medication section is if you use a medication on a quote unquote as needed basis, it's worth writing down how often you use it. So do you use this once a week? Or is it once a month? Or is it a couple times a year? The reason why it's worth writing is depending on the type of medication you're taking, there may be side effects associated with it, and your healthcare team should know what the safe amount is for you specifically. And that can depend on the person and the rest of the medical history that they have. So I'm going to get rid of this now that we've gone through the medication section. And we are now going to go to the next section, which is your healthcare team. So I'm just going to write this down. It's worth having a section where you write down your different doctors, their specialties, and their contact information, because it's not always shared amongst your team, and it can just make it easier for them to communicate with each other in case they ever have to. So if your specialists want to communicate with each other, if your family doctor wants to make sure everyone's in the loop, if for some reason you're in the hospital and some of the doctors in the hospital want to talk to someone in the community, it can just help with the cohesion. So it's worth including that on your overview as well. Now I'm actually going to go to the top of the list now and add some sections at the top. One section that I feel is worth adding is special considerations. And I want you to think about this section as being a place where you can communicate your own personal values and preferences with your healthcare team. I'll give you an example. Let's say someone has been on a medication for many, many years, and it's a brand name medication. However, 10 years ago, they switched to a generic because it was cheaper, and it's supposed to work exactly the same as the brand, but for some reason when they tried it, it didn't work quite as well for them specifically, for their body, and despite the fact that they were supposed to work just the same, in this particular case for this particular person, for some reason it didn't work. If you want your healthcare team to know that, please only prescribe me a brand name medication for this one specific one because I've tried the others and for some reason they don't work for me. That's worth including in a special considerations section or a preferences section because that's something that's very unique to you and no one will necessarily know that off the bat. Something else could be if you want your doctors to know, hey, I really prefer trying as many non-medication options as I can, lifestyle interventions, before I go to taking a chronic medication for the rest of my life. Is it possible that you keep that in mind when you make my treatment plan? That could be worth including. Something else that could be worth including, it's one of my goals that I really want to stay independent for as long as possible. Could you please consider that when you make my healthcare plan? I don't want to rely on anyone else. I want to do everything that I can that's within my capacity for as long as possible. That's worth communicating as well. So if there's anything in particular that's unique to you that you want your healthcare providers to know, it's worth including in one section on your overview as well. Next on my list, I'm going to add power of attorney for personal care. Now, depending on where you work, where you live in the world, I'm just going to fix the spelling on this. Depending on where you live in the world, this may have a different term, but essentially this describes a substitute decision maker in the event of an emergency, a medical emergency. So if any emergency happens, it's worth designating someone that you trust and that you have good communication with to help you have the peace of mind that if something happened, if anything went wrong in a medical emergency type situation, you've already talked to someone you trust to make decisions based on your preferences, based on different what if scenarios. So code status is often something used to describe how you want to be treated in a medical emergency. There are different types of treatment that people can opt for. One is called full code, which essentially means you want all medical life-saving interventions. That's what full code means. Another one that you've probably heard of is do not resuscitate. Let's make sure this autocorrects. Perfect. Do not resuscitate means you refuse any CPR if your heart stops or if your breathing stops. There's something else that's called do not intubate. And this means that you don't want any breathing tubes or any machines like ventilators to help you breathe in case you stop breathing. And there's also something called comfort care. So this may be relevant more so when someone is at the end of their life and they aren't necessarily interested in life-saving measures, but they really want to be comfortable near the end. So this could entail getting pain medications if they're in a lot of discomfort and pain. This could include laxatives in case they're constipated. So those are just some of the different terms to be familiar with and research when you're talking with your designated substitute decision maker, just to make sure that everyone is clear, everyone is on the same page, and you have the peace of mind that if something happens later on down the line, you know that everyone knows what you would have wanted and they can act accordingly. So that was a quick summary of what could be on your medical history overview list. It is by no means a comprehensive list. It's just a good place to start with main essential information that can help you with navigating the healthcare system and just having something that's easily accessible and up to date on you at all times to make sure that you're prepared when you go to a new walk-in clinic or you go to a new specialist, or hopefully you don't have to go to a hospital. But if you do have to go to a hospital, it's good to have this information handy because it gives your healthcare team the context to make sure that they create a plan for you that's safe, that's effective, and easy for you to implement and practical for you to implement. And it can also help ensure that it aligns with your own personal care goals. Thank you so much for listening. If you're interested in getting a copy of a more detailed checklist for you to work through, please comment down below quick Cwuick, and we can send it to you. If you have any feedback for us or any questions, feel free to comment down below. We want to help create resources to help you while navigating the healthcare system because we know it isn't easy and we know taking care of yourself is essentially a full-time job. So let us know what we can do to help you out. Thank you so much for listening. You take care and have a great rest of your day. Bye bye.